Good afternoon, everybody. I'm Katie Richardson, one of the co-founders of Therapeasy, and I am here today with Elinor Nygren Szapiro, and she is from Therapy and Beyond. And Elinor was telling me that one of her specialties in her practice is in working with highly sensitive people, also known as HSPs. So we're going to talk to her about that today. So tell me a little bit about how I would know if I'm a highly sensitive person.
That's a really good question, Katie. I've heard that question from a lot of people, which is why I'm saying it's a good question. People often wonder about that. And interestingly enough, I found that most people that are really wondering if they're an HSP, highly sensitive person, wind up finding out that yes, in fact, they are, because it's no accident that someone is wondering about that. I think I'll first say a little bit about what an HSP is. And being a highly sensitive person is actually a trait that we're born with, interestingly enough. And like most traits, it has pros and cons to it. And when you're highly sensitive, you're basically more open to feeling whatever's going on in your environment. And so we feel things more deeply and more intensely oftentimes. And that could be external stimulation, such as lights or sounds. It could also be other people's emotions, which we tend to feel more or absorb more. Or it could also be our own internal states. So it could be physical sensations that are going on inside of us that we feel more strongly or more tuned into. It could be emotions that are going on inside of us. So how you can know if you're a highly sensitive person, there are several ways. One, there actually is a self-questionnaire, which was designed by Dr. Elaine Aron, who is the psychologist who originally coined the term highly sensitive person. And if you go to my website, one of my websites is www.highlysensitiveperson.org. There will be a link to that questionnaire. And that will help you determine. That questionnaire is actually backed by a lot of research. And it has this, it's about 24 very simple true and false questions that can help you determine that. And also just by tuning into some of the traits of highly sensitive people can give you an idea. Like one of the traits of highly sensitive people is depth of processing, meaning that highly sensitive people tend to think more deeply about things and process things more thoroughly. And oftentimes along with that, worry more. And being a highly sensitive person myself, and which is a lot of why I've been working with highly sensitive people, is because it was a big relief for me to find out I was highly sensitive. And it's often a big relief for a lot of people because we start to feel like there's something wrong with us, there's something the matter. Why is it that I'm experiencing things this way, which is different than most people or more affected? And when you find out it's because you're highly sensitive, there's really a relaxation to it. There's nothing the matter with me. This is simply a trait with both positive and negatives. And about 20% of people actually are highly sensitive. So that's an interesting fact to know. It's not as rare as we might think. And within that 20%, there's a continuum of how strongly highly sensitive you are. So one trait is depth of processing. And another one is overstimulation, meaning that we are more easily stimulated or overstimulated by things in our environment, as I was mentioning before. Another one is empathy, like an unusual level of empathy and an unusual level of being easily having our emotions stirred up or activated. So those are some of the things that can kind of clue you in that maybe you're highly sensitive. If you notice that you are affected by things more easily than other people.
Well, that is really interesting. And being a pediatrician, I feel like I've seen some of these traits in some of my patients. Is there an age at which is kind of the youngest that you could make this diagnosis?
Well, that's another really good question. I don't know if I would know if there was an age at which you can make the diagnosis, but I could definitely say that it's a trait that would be showing up in somebody from infancy.
Yeah.
And an example would be like if an infant is highly sensitive, they will be more affected by the same events than another infant. So maybe an infant is driving in a car, they're a passenger in a car, and it's a bumpy road or noisy. They will get more stirred up by that or disturbed by that than an infant that wasn't highly sensitive. And so you can see that through your whole life, if you're highly sensitive, you're more affected by everything that happens to you. So an event that happens in grade school that may not affect one child that much, if you're highly sensitive, you're more affected by it. So it's easier if you're highly sensitive for disturbing or challenging events to kind of build up inside of you and be more traumatizing than if you're not sensitive. And highly sensitive kids and adults tend to be more anxious and more easily depressed, as you can imagine, might make sense because we're taking in more of what's going on. And sometimes a lot of we're taking in is also from what other people are feeling. And it may be sometimes hard to separate out what's mine and what's yours. And that can happen even starting from childhood.
Yeah, that sounds super interesting. And I heard you mention they may be more affected by trauma. They may have more anxiety or more depression. Um, are there other issues that highly sensitive people might deal with that might be different than other people?
Um, I think yeah, I think what comes to me is, and I kind of mentioned this before, but what comes to me is feeling the pain of the world.
Okay.
And there's so much of it going on right now. And highly sensitive people tend to be absorbing what you could almost call the collective, what's going on generally in the world, and feeling it more deeply. And
Yeah.
not being able to always sort out, is this mine or is this somebody else's? And another challenge with highly sensitive people is being able to ask for what they need. Because being highly sensitive, we might have needs come up that other people don't have. So you might be in a restaurant and the lighting or the noise is bothering you, and it may not be bothering anybody else. And so it can be challenging, especially because you are sensitive, you don't want to upset anybody. It can be
Yeah.
challenging to then ask for what you need and feel like it's okay that you deserve to have your needs met. And so going along with that is what I just alluded to, is that we feel so much for other people that sometimes it can be hard for us to take care of ourselves. We're busy taking care of other people because we can sense what they need. And then we actually get overstimulated. And then when you get overstimulated, which again is easy for highly sensitive people, we tend to get depressed. And so the challenge also with being highly sensitive is sorting out how much to be out there in the world and how much do we need to be inside to take care of ourselves. Because when we are out in the world, which we can enjoy, then we need more downtime to recuperate. Highly sensitive people tend to need more alone downtime.
That makes perfect sense. Thank you so much for going into a little bit more detail about that. So tell me a little bit about how you approach your therapy with highly sensitive people.
Well, one thing is helping people to recognize that it really is okay to be highly sensitive. I support people in being able to accept our exquisite sensitivity. It's oftentimes hard to see it as a positive as well as a challenge. And so I also support people in seeing some of what they have to offer as a highly sensitive person and some of the gifts that come with being highly sensitive, and helping people to really tap into the calming, soothing nervous system through some of the other approaches that I use, like brain spotting, like hypnosis, like meditation, which can help you to really tap into that rest and digest, parasympathetic, spacious place inside where everything, you can allow everything that's arising to simply arise and move through and be okay.
I can tell Your voice is just so soothing. So I can tell you would be really good, I think, about helping your patients get into that more rest and digest mode. You mentioned that there are some positives to being a highly sensitive person. Tell me more about those.
Well, highly sensitive people are deeply intuitive, as you might imagine. Highly sensitive people have an easier time actually of slipping into calming meditative states. So it's like the antidote. We have the antidote as well as the challenge. And highly sensitive people are usually extremely conscientious, processing things more deeply. We're able to get to the bottom and the depth of what's going on. We're looking for the real meaning in life and are really good at forming meaningful connections with other people rather than just surface connections with people. In past times, what Elaine Aron, the founder, the guru kind of therapist who coined the term, said that highly sensitive people in the past were likely advisors to the kings. And now in these days, they also are likely people that would be tapped on for their intuition or for their advice.
Well, that is very cool. Elinor, thank you again for being with us today. It's Elinor Nygren Szapiro of Psychotherapy and Beyond. And you can find her on the Therapeasy site at therapeasy.co. Thank you so much for being with me today.
Thanks, Katie.